60 to 80% of newborns have jaundice, and some babies have more jaundice than they can handle. Because you remember, these babies who are born, they are like brand new babies. They have so much to deal with. Their liver has to basically pick up the bilirubin that's formed from the destruction of red cells. It has to metabolize it. It has to make it water soluble. The babies have to learn to feed. They have to learn to pee. They have to learn to poop. They have to be able to handle this. And many times the children either have their own risk factors, like they're too small, they're too premature, they're too large, their moms had diabetes, they had a difficult birth, they had a small bump on their scalp which had extra blood that they need to metabolize. They can have jaundice because the mom is O positive and they are A positive and they have incompatibility of blood types. So there are many, many reasons why the newborns have jaundice. And depending on the risk factors, whether it's maternal risk factors or the baby's risk factors, some babies have a lot more of it. So there's a graph called the Bhatia graph. The nurses will actually walk you through this because they will show you how old is the baby, what is the jaundice level, what's the risk factors, So we basically just sort of plot it so we know which risk factor, which risk category the baby is in. So if you are in the top two categories, you're likely to have more jaundice because, historically, the babies will have more jaundice between the 2nd to the 7th day of life. So if you're already starting off high, you're going to have more, and you will need intervention. And the treatment for it is pretty simple. You just want to encourage breastfeeding. You want to make sure the baby is able to excrete this. And sometimes they need light therapy for it.